From Kalamazoo, direct to you, it's a WKZO.com quickcast.
Advocating for any particular thing at this moment. This is about listening to you. There are so many ideas of what needs to be done for healthcare reform at this time, and we want to enable you to tell your stories about your experiences in the current healthcare system and give to us and give to this community an idea of what you'd like to see change. Because we all know that there needs to be some changes, some fundamental changes in the way that we deliver healthcare in this country. First, let me just explain how it's going to work. Once I'm done with some of the introductory comments, we're going to have people line up behind these two microphones that you can see up here. There's going to be a 4-minute time limit on your stories or whatever you want to talk about with regard to healthcare reform. And because there's so many people here, and I'm sure a ton of different stories, we've got to be very strict with that 4-minute limit. What I'm going to do is there's a gentleman at the back who's going to start a stop clock. You can see it. Can you raise your hand, Will? Just one more time. He's got a stop clock on that computer right there. He's going to let me know when 4 minutes is up. And then we're going to go to the next person, okay? So let's just get to some things. There's a lot of different ideas about what we need to do with regard to reforming healthcare. But there are some fundamental facts that we all should agree on, at least. The first is that 47 million people in this country have no health care. 14,000 people lose their health care every day because they lose their job. They become too expensive to insure. They're dropped because of a pre-existing condition, and they simply can't afford to pay for health care. Annually in the United States, about 1 million people declare bankruptcy because they can't afford their health care. According to the Institutes of Medicine, a nonprofit organization, 18,000 people die a year because they don't have access to proper medical attention and they're uninsured. The United States spends more on health care than any other industrialized nation, but we don't see the overall health outcomes correlate with that amount of money. The World Health Organization ranks the U.S.'s healthcare system number 37 in the world, just ahead of Slovenia. Healthcare costs and premiums are rising at an alarming rate, and wages just can't keep up. If nothing is done, if we don't do anything, then what's going to happen is within 10 years, families are going to end up spending 50% of their annual incomes just for health care. And this is happening here in the United States, the richest, most affluent, most innovative country on the face of the earth. We need to do better. We have to do better. So let's begin the discussion tonight. We know that at some of these town hall meetings across the country, we've seen the news, we've seen it on the internet, we've seen it on TV. They can get raucous. There are passions on both sides of this issue. What we're expecting tonight is a civilized, mature, respectful discussion on a very, very, very important issue. We stand at the precipice right now of the first opportunity to fundamentally reform healthcare in about 45 years. Let's get it right.